Hi everyone, welcome back to my YouTube channel. Today we'll be diving into patient assessment. Patient assessment is one of those core foundation in patient care that we look into. And for the purpose of this study, my reference book is Torres for those that have been using Torres to prepare for their exams. Right. This is a very good recording to help you understand more about it. So we are building the mindset you need as a radiographer. In this video, we'll be covering the health illness continuum, something we also call spectrum, the critical thinking, cultural diversity, patient care, and just stay tuned till the end. We have a case study that we would be solving. So solving a case study helps you to understand the picture of what is being spoken about more clearly, right? And also helps you to retain those informations better. Now let's dive deep. What's health illness continuum? Health illness, sorry for that. Your health illness continuum is a spectrum of health. It's a spectrum of health. And when you talk about health, health is not just the absence of disease, but health is a dynamic state and is a spectrum from optimal wellness to severe illness. So it's like a spectrum of um, optimal wellness, sorry, when someone is health is so good, someone is strong, someone is feeling very good, to severe illness, critical illness. So, and every patient is at different parts of this continuum every time at different phase. So people come back and go forth along this continuum. At some point, we feel very strong, very agile, having a sound health. At some point, due to stress and a few things, one could become ill. At some point, some patients might suffer from very severe illness. Some might even eventually suffer from terminal illness. Maybe after treatment, get back to being well again or get back to being very good. So at a different phase, at different point in time, we are all, everyone is at different, every patient at different spectrum of this health illness continuum. Now, radiographers' role is they need to recognize when this patient is on this continuum and adapt care accordingly. And what's this care? We need to assess that they are in this continuum because it affects how we communicate with them, how we position them, and how we handle emergency. Or this person is very ill, or this person is at this level. Okay, how well are you able to communicate and try to help this patient feel the way this person is feeling and administer proper care? So having or understanding this continuum just helps radiographer to administer or adapt the care according to how or where this patient is in the spectrum. We are not just imaging, but we are caring for a person in a specific state of health. That's what we should know. And from there, there were a few key terms that was used when you talk about wellness. Wellness is a high level health, very good health. When you talk about illness, deviation from the normal function of the body. And when you're talking about adaptation, how the patient cope at different phases, at different stage of this health illness spectrum. Now, moving on, we move next to understanding what critical thinking is because it's in critical thinking that we are able to administer the appropriate care to this patient, even at different phases of this health illness spectrum. Now, critical thinking is one of the most important skills you develop as a radiographer. It's not just about being smart, but your ability to analyze, your ability to evaluate and synthesize information to make a reasoned decision for this patient. So, when a patient comes in with an unclear issue or an unusual symptom, you need to gather information and you not just leave it at gathering information. Someone that is critically thinking, right, will weigh the options available. Oh, this patient position, this patient state of health, can it adopt the usual positioning for this examination? And if it cannot, what can we do? Does the benefit of this examination outweigh the risk? Right. So you have to weigh your options. And after now getting the information, weighing your option, someone that thinks well will also make a safe decision to bring this person to a better state of health or to make adequate diagnosis that can inform treatment or to just keep this patient more comfortable and administer therapy, right, for this patient. So, critical thinking, that's the end goal. It is purposeful, it's an intentional act, it is self regulatory, and it is evidence based. And note that the exam will test this by giving you scenarios. That's why I said at the end of this lecture, we have case study, we have case scenarios. The correct answer is usually the one that shows you are thinking critically, not just following a routine. It is far beyond what we were taught in our technique, what you were taught in image analysis. That also has a role to play. But first, your ability at the spot to actually think and come up with creative solution, come up with informed based decision, right? So that is it. And what's the structure to this process? The first is interpret, right? Interpret, evaluate, infer, restrain, and reflect. So let's go again. The ability to interpret. And when you're talking about interpretation, you interpret the patient's behavior and the ability to determine the course of actions and need for the procedure. So from the patient information you've gathered, you just interpret what it is inferring or based on the patient's behavior, what is going on. Then what can you do? What's the course of action that follows? Right. And why is this procedure necessary? So this is the pattern of the pattern by which first the person just once the person gets maybe the case history or a patient appears in their room or in the department, the first thing is you interpret, you check your patient's behavior, check the patient's history. What's the next thing we are supposed to do to this patient? What's the next course of action? Then what is the essence of this procedure? Then after that, after interpreting everything, you now evaluate the patient itself. Oh, can the patient, what's the state of this patient? Can the patient comply to commands and instruction? That's where we evaluate. Can the patient adapt the positioning comfortably? Right. What is the patient doing at the moment? How is the patient feeling? When you evaluate all of those things, it informs the technology that okay, this is the next thing to do. Then after now evaluating, mind you, the first is interpret all of the information you've gathered. You look at it and say, what's the next procedure? Then you evaluate that, okay, this procedure that is the next step for me to do, can this patient comply to it? Right? Can this patient comply to commands, instruction? Does this patient understand? What's the state of this patient's health? Can this patient easily adopt? Then the next thing is infer, or you come to a conclusion that we're reached through the process of interpretation and evaluation. Okay, from your interpretation and from your evaluation, what do you conclude? Right, for a patient that just walks into your department and patient is on the trolley, coughing, sneezing, and they ask you to do a chest x-ray. You check, okay, this is the patient's case history. To do a chest x, we need to do a chest x-ray. And why would you need chest? And we need to check the lungs. Then you evaluate what's the state of this patient's health. Is the patient very ill that if you communicate that breathe in, breathe out, the patient won't be able to do it? So you try to evaluate. Then adding these two together, you come up with a conclusion. Oh, I think from what I have seen, this patient cannot do this. We might just have to, the patient might not be able to follow or comply to our breathing instruction. We might just have to watch the patient while the patient is briefing normally. So that is where you call infer, that is you conclude based on what you have interpreted and evaluated. Then when you are done, you now explain to the patient in terms that the patient can understand. Now you already come up with what you want to do. If the patient is someone that can listen or can understand, you can go ahead to explain, oh, we're about to do this. I will need you to take a deep breath in. I will need you to take a deep breath out. Or if it's a patient that cannot understand your instruction or cannot comply to commands, you could talk to the relative by the side. Maybe the patient relative wants to hold the patient down. Oh, we need your relative to be very still, so you could just talk to the patient so that you're explaining the procedure. Explain, oh, at some point we'll have the patient breathe in or breathe out, or at some point. So that's the next part of explaining the procedure. That's the next part of critical thinking. Then the last one is reflect. You reflect, okay, now we've done the whole process. What's the outcome of the process? The image we've gotten, is it of good diagnostic quality? Is my patient comfortable? Is my patient better? The state by which the patient came into the department, is it the same way, or is the patient that has deteriorated? So you reflect on the outcome of the whole process, and the whole process I did to achieving this goal. How well was it? Right. So this conclusion of the critical thinking process, when the technology is able to determine whether the outcome was a good one, very good one, or whether it is acceptable, and if not, if you notice any error in the train, we can go back to the drawing board again and see what to improve on or what to work on. So that is the whole process of a someone that is critically thinking. Now, moving on to the next slide, we have what are the modes of thinking, because it's necessary for us to establish the mode of thinking. So, the thinking comprises of a variety of things, right? First is a recall, we have habit, we have inquiry, and we have what you call creativity. Right. So let's quickly check. So Torres describe this mode as this whole process, and we need to understand what this process specifically is. Now, when you talk about, let's start from the ability to recall. When you talk about recalling and the modes of thinking, right? The first is recall means ability to bring to mind a large body of fact quickly. This is something you've been taught before, maybe for a radiographer or something they learned in school. Ability to quickly to remember. That's what you call recall. And as a type is a mode of thinking. Another is habit, something that you do over time. That skill that is built by something you do over time, or the radiographer that has like about or a student radiographer that has about goes to posting consistently and has like 5 to 6 month experience while doing chest x-ray over and over again. There are skills the person builds by repetition. So that's habit. That's another mode of thinking. Then the third is inquiry, that is to process information thoughtfully and by willing and able to recognize, explore, and challenge assumption to make a complex idea. So this time around, you're not just recalling alone, you are not just doing something based on habit, but your judgment to every situation is by the peculiarity of the case. By the peculiarity of the case. So your ability to recognize what is before you, that it is different from another person's own. Explore what positioning or what mode of care, what mode of position one can administer, and when there are challenges that comes up, what are the things you can do to get something better? The ability to do all of that is inquiry, and that is a more advanced mode of thinking. Then the highest of all those mode of thinking is creativity, ability to conceive an alternative method to perform task. And this advanced word, both inquiry and creativity, are very important for every professional. No two patients is the same. No two patient is the same. So it's more than you recalling what you were being taught in class. It's more than you have been constantly doing something and the skills you've developed. But for every patient that comes, you make there is the part of inquiry that is you recognize the peculiarity of that situation, recognize what you can do, right? And when challenges come, the challenges you can encounter, they now bring up creative solution. What are the alternative to this if I can achieve it this way? So that these had the modes of thinking that we have. And the following question should be asked while thinking. Yes. What are the questions that should be asked while thinking? So the ability so one of that is, am I remaining in the lower level of thinking most of the time by using only recall and habit to solve problems? It's only recall and habit because that's the lowest mode, and that doesn't show proficiency. Another question you could have, do I move beyond this lower level of thinking into the realm of inquiry by exploring different ideas, different methods? In technique, you would hear stuff like we have basic projections and we have modified projections. So for you to explore all, to just give you a very good quality image, right? So this is the question you ask: validating. Are you analyzing the problem? Then next is, am I combining thoughts, idea, and concept to find a better solution? The ideas you have, the technique you've learnt, the patient care you've understood, bringing all of them together. Are you doing that? Are you combining them to find something better? Then, are you creating new approach to solve difficult patient care problem? What are the new approach? for a pediatrics that you want to take a position and the pediatrics is not stable, right? What are the new approach you are beginning to think about to administer to this patient? And when you are done, are you carefully evaluating your work? So these are the questions you ask. Having to go through all of this helps you to think well, to be a very critical thinker. Thereafter, successfully um, administering the best patient care to every problem. If a habit of higher level thinking has been developed, then creating successful solution to problems becomes your second nature. So if you've done something over and over and over again, the second best thing now is not just that, like I said, not to patient is the same, is creating a successful or a better solution to solve problem. Now, this moves us to the next, um, and that is what are the problem solving requirements. We've talked about critical thinking, your ability to not just see things, but when you're a critical thinker, you're analyzing things, you are getting things right, you're bringing up creative solutions. And we also talked about the modes of thinking from recall. After recall, we have habit. After habit, we have inquiry. After inquiry, the last part is creativity. Now let's go to problem solving requirement. Now, problem solving is a structured process. You identify the problem, you analyze the problem, right? You give general solution, pick the best, then evaluate your result. So you're looking at that problem. You're not just looking at that problem, but after looking at the problem, you're analyzing what's the possible cause. What can I do? What are the things to put together? Then you bring up a solution. Out of all of those solutions, you pick the best again, the best that suits the patient. Then when you're done, you evaluate. And I want us to take note of evaluating result. That's it is as important as anything. So radiographers face complex time sensitive problem every day. Every day. And mind you, take note of that word time sensitive problems daily. What are the steps in problem solving? The first step is data collection. Data collection is the first step. And for data collection, data collection is explained in two very key sample. One of it is subjective. You have two type of data. You have your subjective data and you have your objective data. So what is subjective data? Subjective data is anything that includes anything that the patient that is in the patient, right? Or whatever the patient tells you, whatever is in the clinical history, right? Anything pertaining to the patient that the patient's that is written from what the patient says, what the patient relative says on the clinical history is what you call a subjective data. But objective data is what the radiographer himself sees, hears, perceives, feels, or read on the patient's chart or anything reported about the patient. Sorry, so subjective data is anything the patient itself, because she's subject to the patient, whatever the patient tells you. When I talk about objective is what is written on the case notes, right? What the radiographer sees, what he hears, what he smells, what he can read from the room. That's what you call your objective data. It's just like the name implies, subjective to the patient. Whatever the patient is saying, whatever the patient is relating, is saying that the patient is feeling. For instance, something about subject data is the patient might say, the last time I had an x-ray, they gave me a medicine in my vein that made me itch all over. I can't lie flat because I can't breathe in that position. So that's subject. That's what the patient is talking to you about. But objective is what you see, what you read, what you feel. Maybe a patient is not breathing well, or a patient is not cannot hear, or what is in the case notes. That's what you call objective data. Then the next process is data analysis. So after getting the information, right, there is the need to analyze the data. So it integrates all this as analyzing the data integrates all the segment of critical thinking, all of the segments. So the reviewer mentally reviews the subjective data, that is what the patient tells them, and what is in the case note or what he sees around. So when he now analyzes all of this, it will now bring out an informed decision, right? That is relevant to what he has already gathered from the patient. Looks at, is there any problem? Then if we take this position, what is the likely problem to occur? What are the solutions we can give? So when you analyze all of this based on the information one has gotten, that is a part of data analysis. And the process, you first collect your data first, subjective data or objective data. You analyze all of them with every form of critical thinking. Because at this point, you are thinking every process, every mode, right? You analyze what are the problem, what is the possible solution, what can I do, what can I maneuver? What's the thing I can do? So there you analyze the problem, you analyze everything. Then the next thing is planning and implementation. Planning and implementation now comes into place when after the data has been analyzed and a goal is set with objective for achieving it. A plan is written for achieving this goal. How do we plan on achieving this goal? For example, the patient comes in and you want to do a chest x-ray. The patient is oozing, the patient is coughing, the patient cannot breathe well, and the patient comes in, you analyze the patient. Oh, this patient, that means the patient cannot stand. That means if we ask this patient to stand, I don't want the situation whereby the patient will fall. So you analyze all the problems that can possibly happen. Then after analyzing that, what's the objective? What's the goal? The goal is to take a very good chest x-ray that the doctor can see, right? To know what's going on in the lungs. That's your goal. So now at that time, the patient now, the radiographer now begins to um look at what areas, what are the things, what positioning is best. Is it erect? Is it supine? Yes, and sometimes this can be developed maybe by your practical experience previously gained, right? Or maybe by just looking at a very creative solution or talking to someone more superior to you. That's for patients planning and implementation. Then the next part is evaluation. After the examination has been properly carried out, there is the need for evaluation. As a beginning student, the reviewer will be expected to perform this phase of care in writing or with an instructor's assistant. A self assessment of the student performance is made as well as an assessment based on quality performance standard. That is, what is coming out, that is, what's the results? Is it of good image quality? Is the patient comfortable? That's the process of problem solving. So, the first thing, let's go again, is collect your data, objective or subjective. After that is analyze the data. What's the possible problem? Like, what's the condition of this patient? Then the next thing is planning and implementation. Plan the protocol or the tests to administer. Then implementation is you now implement it on the patient. You carry out the scan, carry out the procedure in that way you have planned it. And then evaluate when the result is out. And this evaluation can be done by yourself based on the quality of the image produced, the comfortability of the patient, right, and the outcome. Or maybe by a senior colleague, a senior radiographer, a radiologist while reporting to can also evaluate. So after evaluation, you know that, oh, this process I have carried out, is it of good quality or there is the need for improvement or the image needs to be retaken and cannot yield any diagnostic results. Now, let's move on to, I think, what is cultural diversity? Now, moving on to cultural diversity. Cultural diversity is not just about being nice, oh. It's about providing a safe, effective care. So this is recognizing, respecting, and valuing differences in race, ethnicity, language, religion, gender, age, disability, and socio-economic status. If a patient doesn't understand you, or if their belief affects how they respond to care, your exam could be compromised, right? And cultural competence means you need to just adapt. You need to understand their belief system. You need to ask questions while communicating. You need to listen. You need to be able to read the room, read their countenance, take note of what's with them or what's on them, right? And the key principle is to provide patient-centered care that respects that patient's belief, that patient's value system, right? So example is you could use a certified interpreter, right? If the person cannot understand your language, maybe English you're speaking to the person, or you respect the person's modesty, you accommodate religious practices as well. So all of this just make sure that just makes the patient so comfortable and make the patient seem like they are the center of everything. So the exam will test you. This exam particularly, I don't know which of them, but they will test your awareness, not just your knowledge, your awareness. How well do you know some of those things? So, I said cultural competences, the ability to understand and respond effectively to the cultural and linguistic needs. Yes, they're linguists. Some of them might not understand your language. So you just need to, if possible, get an interpreter. Now, what is our patient expectation? Patient expectation. Patient comes to us with expectation. Some expectations are spoken, some of them are not spoken. If they expect to find you very articulate, very concerned, very clean, well-grown professional to provide care. So people just see by they just judge one's appearance or one's first impression, and it depends on how well you communicate with them. They might become difficult to manage while in your own hands, right? So patients, they have expectation. They expect to be treated with respect. Yes, they expect to understand what's happening. They expect to just feel safe. They expect to have their own privacy protected, right? And as much as possible, every radiographer needs to know this and be able to meet up to this expectation. If a sense of understanding is not conveyed, the patient may be left with a feeling of dissonance and may feel that the healthcare received was not therapeutic. They might feel left alone. They might not be confident in the healthcare they must have received, right? And healing starts from the mind, right? I remember I had that conversation with someone. It starts from the mind. So if they feel loved when coming to your place and the expectations are being met, it's the start of a of the good state of their well-being, basically. Yeah. So meeting expectations equals to trust, cooperation, the patient will cooperate, they trust you, then eventually better images. While failing to meet expectations, they become very anxious, confusing, and it might lead to repetition of scans. So as much as possible, you want to be able to meet up to their expectation. That's why for a professional, there is a dress code. There is a dress code in terms of decency, yes, cleanliness, the way you approach, your first impression, the way you communicate. So this just helps the patient. It helps you at the end, at the long run, get a better response from your patient. Now it's time for our case study. It's time for our case study. So let's check through our case study to just make all of the things we've learned sink better. Yeah, trust that we are ready. We are tracked up for our case study. Yes. Now let's read our case scenario very quickly. You are a radiographer working in the diagnostic imaging department of a community hospital. A 68-year-old woman, Miss Chen, is brought in for a two-view chest x-ray with a suspected lower respiratory infection. She's accompanied by her daughter. Now, upon assessment, you note the following. Miss Chen speaks limited English and appears anxious and withdrawn. And mind you, when we talked about assessment, then we talked about data, two types of um, getting data. One is objective, one is subjective. So maybe the radiographer we're talking to, I noticed that she cannot speak English by what is yeah, or maybe she says it as something. And objectively, right? So all this information gathered is what is here. So she's sitting upright in a wheelchair, breathing rapidly and slowly. This is an objective data collected because the radiographer can see it. Her vital signs are 112 BPM, 26 respiratory distance per minute is 26, XPO2 92%, room air temperature 38.2. That's a lot. That's showing that she's really healed. After that, explains that her mother has been coughing for 5 days and feel weak and confused. Remember, when I talked about subjective data, this is this type of subjective data, the information that the doctor or the patient relative is given alongside the patient. Doctor also mentions that in their culture, modesty is very important and a mother is uncomfortable being touched or exposed by male staff. So the patient has not signed a consent form yet. The student radiologist with you says, we always do chest x-ray with the patient standing, arms up. Sorry. We always do chest x-ray with the patient standing, arms up and breathing in. That's what I learned. Let's just get her to stand and do it. The doctor asks, will this take long? My mother is very tired and I can stay with her. Or can I stay with her? Sorry. So now let's look at the questions that accompany this because just because of them, you can just go back to read this case study and try to answer it. Now, what's the first question? It says, based on assessment finding, where is Miss Chen on the health illness continuum? Optimal wellness, illness, moderate to severe illness, or terminal illness. So our answer is moderate to severe illness because looking at looking at the information we gathered, heart rate, yes, our vitals, our temperature, our BP, and all of that, you can see where it holds. She is febrile, tachycardia, hypoxic, confused, and weak. So these are signs of an acute, significant illness that requires an immediate attention. So for your exam tip, the exam will just give you vital signs and observation, and you must interpret where the patient is on the continuum. Right. But if you check all the vital signs, you would be able to know. But at this stage, the patient is moderate to severely ill. Now let's look at the next. Now, looking at the student technology is primarily using which mode of thinking. Remember that the student technology said, what did she say? The student technology says, we always do chest x-ray with the patient standing, arms brought forward and breathing in. That's what I learned. Let's just get her to stand. So that's the type of what mode of thinking. That's recall. That's recall. Your ability to remember things that is being taught. So that's recall, and that is not a. Remember when we talked about mode of thinking? That's the least part of thinking, and it is not sufficient to appropriate or to give appropriate care to your patients. It's not relying on the memory. Instead, one is supposed to bring facts quickly, read, analyze, interpret, make informed judgment or decision based on the peculiarity of the case, not just by what the book says or what one learned. So the student at that time is using a recall mode of thinking. Now, what mode of thinking should the radiographer use first in the situation? Inquiry. That's what I would pick because when we talked about inquiry, remember that we talked about inquiry as assessing the patient, explore different opportunities. You're exploring it. What's the doctor's concern? The doctor said that the woman is not breathing well and she has been weak for 5 days and all that. To explore all of the doctor's concern and say, okay, let's analyze that. Let's assess the patient based on the patient's vital signs, right? Then look at her cultural needs as well. She doesn't touch male patients, shouldn't touch her, and this, that. And now evaluating clinical practice, what are you supposed to do? So adding all of this holistic approach together helps you give the right and appropriate care. So inquiry, that's what inquiry really talks about. Inquiry is not recall that you just remember this or happy something you've done over time. No. But inquiry is you sitting down to get the information, analyze what's going on, evaluate it, the clinical picture, explore the doctor's concern, explore the technique that you can adopt to get the best positioning. Yeah, trust me, I'm moving on. Then the next is what is the first problem solving step the radiographer should take? Remember, in our problem solving step, we had, let's go again, data collection, data analysis, planning and implementation, and evaluation. Remember. So now let's check through. Position the patient for the x-ray, ask the doctor to step out, assess the patient condition and clinical needs, send the student to get the portable x-ray. What's the first? The first that we talked about then was data collection. And if you check through all of this, the best that fits into data collection is assess the patient's condition and clinical needs. What's the patient's condition? And what's the clinical need of the patient? So, the patient condition is, mind you, that's the collection of data, either objective or subjective, based on whichever way you collect your data. So, that's the first on the problem solving requirement. I hope we're enjoying this because I am. Then the next question says, what is the most appropriate action regarding Miss Chin's cultural concern? I would pick assign a female technology to perform the exam and explain every step clearly. Why will I pick this? Is because check through the first part. This disrespect the patient's cultural value of modesty. She says she's very modest and she does not like a male patient to touch her. So yours as a radiographer, what will you do at that time? You would assign a female technologist to perform my exam and explain every step clearly. Cultural competence is not optional, it's very compulsory, part of safe, patient centered care. And for just the tip on the example, we reward you for respecting diversity and adapting this approach. Yeah, so moving on. Miss Chen's daughter asks if she can stay. What's the best response? From my own, from what we've learned, the best response for me from this option is you can stay and help comfort your mother. I will explain what we are doing and we'll work together. So this response meets the patient expectation of dignity, support, and clear communication. So at that point, the patient, because the patient, her expectation was, can I stay with my mom when she asked that question? So if she can stay with her mom, provided that she is protected and you just give her a let it run. I feel like that way it makes her more comfortable and ready to assist. Now we have the last question, and the last question is, what's the best approach, overall approach for this patient? And I will pick assess the patient. That's the first thing. Use a possible portable upright or semi-erect technique. Explain each step. Assign a female technologist and allow the daughter to stay with appropriate shielding. So this explain everything about the first part, which is patient assessment we talked about. So assess the patient. Is patient fine? What's wrong? Collect your data, analyze it. After analyzing what's wrong with her, what is this what's your plan to take into examination. So you could use a portable upright. Since she's on a wheelchair, you can do it while she's sitting. Just place like a detector behind her, or you can do it in a semi-erect position as well. Explain each step to her. Oh, mommy, I understand how you're feeling. This is what and what you should do. Then assign a female technologist to assist. She's very, if you're a male technologist doing it, just assign a female. Then allow the daughter to stay in with an appropriate shielding. And with that, you're a very competent radiographer. Thank you for watching. Like and follow for more and share. For those preparing for any sort of exam or for those students that are just in their first year, second year, or they are planning to come into medical imaging technology or radiography. This is the best platform or the best channel you want to be in to get the right information. See you in my next video.